Sometimes I wonder what people think doctors do all night when we get a call from the emergency room and just kind of appear out of nowhere to see these kids that come in. Uh, I don't wonder. I wonder if they even know what we do. So, as I'm here on my pediatric neurosurgery rotation, so kind of backing up a little bit for neurosurgery residency, it's 7 years long, like I've explained in other videos. So that's 7 years of additional training after medical school. So as part of that 7 years of neurosurgical training, we spend in our program 6 months doing pediatric neurosurgery at a children's hospital. And as part of that training, we take call. And what call means is we're available here in the hospital for a 24-hour period. So anything related to the brain or spine that could potentially need surgery, we get called about. And then we go down to the emergency department, or if they're a patient on the floor, then we go and see them and just kind of get a history and figure out what images we want, and then kind of formulate a plan and make a diagnosis. So yeah, so we have a call room where we stay, and we have our list of patients that are in the hospital right now that we get called about from the nurses up on the floor, as it's called, and if everything's well there, then we have a quiet night. But we also get calls from the emergency department for kids that come in that have neurosurgical issues, as well as we get calls from other hospitals around the area. So I'm here in Colorado, and we get calls from Montana, Kansas, New Mexico, really just a big, huge surrounding geographic area from other emergency departments that have questions about how to maybe manage neurosurgical issues for kids, or they have kids that have neurosurgical issues that they want to send to us for treatment and that kind of thing. So we're here, and after we see these patients, and we have to do paperwork and write notes and kind of put in orders for our plan, and then as a resident, we have an attending neurosurgeon that we're on call with, and basically run all of our patients that we see through them and make sure that they agree with the plan and say, yeah, that's good, or maybe consider adding this test on, or asking other questions and that kind of thing. So really residency is like an apprenticeship, and I'm just trying to learn and figure out the best way to manage these problems, so that hopefully at the end of the 7 years you feel comfortable enough to kind of be out on your own as an attending neurosurgeon. And it's you always have colleagues that you can bounce ideas off of and that kind of thing, even after you finish residency. And that's kind of the beauty of it. You make friends through this process, and you can kind of help each other out, and ask others as a team kind of how you would manage different scenarios and that kind of thing. So tonight I'm on call all night long, and taking calls from the emergency department and outside hospitals that want to transfer patients here, and that's what we do. That's what call is. Since I've been here, pretty much every third night I've been doing a 24-hour shift that ends up being like 27 hours, because when the team comes in the morning, then you tell them about all the patients that you saw overnight, and kind of talk to them about the plan, and look at the images and pictures and CAT scans and MRIs or head ultrasounds. And then you go around and see those patients with the attending neurosurgeon, and make sure they don't have any questions, and kind of check out before you go home. And then we kind of sleep and get whatever rest we can before we have to come back and kind of do it all over again. So anyway, I hope that's helpful. I don't know, I'm sure a lot of people don't really know the whole ins and outs of what it means to kind of be a doctor on call, and especially in neurosurgery. But yeah, so maybe I can try to give you more insight into, how this whole world works of medicine and being on call in the hospital. So